Hi everyone, this is Dr. Garner here. We are here to talk about what it takes to be able to walk, jump, run, skip, hop, or do anything without hip pain and pinching in the groin. So today we're going to look at a very, very subtle movement because the hip has to go through a slight movement like this and like this in order to be able to do all the things I just mentioned. So I'm down here on the floor with my lovely, thank you for being a model here, with one of my patients. And if we're sitting in a wide angle position like this, okay, we want the toes to be able to turn up. If they don't, then you need to have your ortho and pelvic PT measure what's called femoral version, because you may not be able to get into this position safely because maybe your hip just doesn't have that motion available. So if you sit here and you can't point your toes straight up, that could be a separate problem. So you need to have your femoral version tested. If your toes turn straight up but you're kind of slouching, then put a couple of books under you, or a yoga block, or a blanket or something. I prefer blankets, yoga blankets really, to lift you up so that if you have tight hamstrings, right, it takes the stress off your hamstrings. To know if you have tight hamstrings, which we just got finished testing, you would put your legs out straight and see if you can arch your back with your legs straight or with your knees slightly bent. So if you can do this, and I can arch my back with my knees slightly bent or straight, then your hamstrings are perfectly fine. But if you bring your legs out to the side and then all of a sudden you're slouching, then it means it's your inner thigh muscles that are tight, not the hamstrings. And so that's the case that we have today. It's not our hamstrings, they're totally fine. It's these inner thigh muscles. So here's the little subtle trick that we're working on. When she brings her legs out to the side, so you can go ahead and bring both legs out to the side, we are stretching the hip joints out, okay, a little bit, just pointing them up. We're going to try and take the pubic bone, so the bottom base here of the pubic bone, you're going to take it down to the floor and then back up again while keeping your toe pointed straight up. It's a very subtle movement, and it doesn't even require turning the trunk, okay? So I'm bringing that part of the pelvis down and back up again. What does it look like when I'm actually doing the movement? If you look at the middle seam of your pants, come right off the edge of that seam, and that's where your pubic bone is at the bottom. I want you to bring that side of the pubic bone down while keeping the toe up on your left side. Bring it back up again. Now bring the right side down and back up again. And then compare which side feels tighter as you do that. So which side feels tighter?
This one? I feel this one more.
Yeah.
Remembering.
So the leg we've been working on, she does feel more. So that's going to be the homework. It's not a stretch like this, right? That's not what's important. What's important is that subtle slide, glide movement in the pelvis, which is influenced by the muscles, by the fascia, by the nerves, by the vascular structures, by the tissue as a whole that surrounds it. It's not just flexibility, right? That's not what is important. It's about tissue mobility and pliability. So the first thing that we started out working on, was just the ability to pelvic clock and roll the pelvis. So take the pubic bone straight down by arching the back, and then take it over to 1 o'clock, 2 o'clock, 3 o'clock, 4, 5, 6 o'clock, 7, 8, 9, 10, 11, and as you get back up to 12, arch the back a little bit, yeah. And as in arching the back, this is where the subtle movement comes in. Take the left side of the pubic bone towards the right foot, while keeping the toes straight up, and then bring it back. And now take the right pubic bone down and towards the left foot, almost like you're trying to put the bone on the floor, and then back up again, okay? And that's it, just doing that little pelvic clock in this position, and then doing that pubic bone drop to the floor to try and work on just tissue responsiveness, okay? So that when you're walking, when you're jumping, hopping, whatever it is that you want to do with your hip and your pelvis, you're able to get that subtle movement of this side of the pubic bone dropping down, and then the other side able to drop and move, so the pelvis as a whole is more mobile and not influenced or held tight by the restriction of the muscles that surround you and attach at the top of the pubic bone. All right, hope this helps you guys.